Today we're going to have a talk about testosterone replacement therapy, and in particular being on TRT medically, prescribed by a doctor in your early 30s. Maybe you're in your late 30s and being put on the TRT and you're wondering exactly what may happen within the United Kingdom to get TRT. Now, for getting TRT in the UK, a lot of people think that getting it on the NHS, which is the main public health system in the United Kingdom, that it may be difficult to get that. On the contrary, I've had quite the opposite. The first off was realising all the symptoms of low testosterone and knowing exactly what they were. Approaching the GP, your general practitioner, basically your family doctor, and ask them for a blood test. A lot of people in the United Kingdom, especially if you're in your early 30s the way I am, the GP may not test for testosterone. They'll simply say you're too young for it, you couldn't possibly have this done. Now, given the past, some people may say do not be honest with your steroid use, etc. I don't think that's a very productive thing to do if you're going to approach a doctor. With my own doctor, I went and spoke to him. I told him exactly what was going on, that there was, no sex drive, brain fog, depression, anxiety. One of the worst parts of low testosterone for me was insomnia. Your whole sleep is completely messed up. You wake up continuously throughout the night and you're constantly drained of energy. You're in work and come 11 o'clock in the morning, midday, you're drained and you just want to go home, you just want to go to bed. And the cruel irony of it is that when you do go to bed, you don't have the ability to actually stay asleep. And of course, for me, this went on for a year and a half, 2 years of when it started getting really bad. So the first part that I was given was a referral to an endocrinologist. Now, in the United Kingdom, you may have to wait a while to actually see an endocrinologist. It can take anywhere from 3 months to 6 months to 1 year, or else you can pay privately. So either way, I waited a couple of months, seen the endocrinologist, went through the history of everything. I had blood work that had been carried out by the GP, and from that blood work, I had the testosterone levels of a 95-year-old male. It was next to non-existent, and it had been a few years since I'd ever taken steroids or pro-hormones. My body just didn't bounce back. It didn't recover from it. So the endocrinologist went through a lot of tests, had a lot of blood work taken where they'll test everything from your thyroid, growth hormone, IGF levels, and also it is common practice for a lot of endocrinologists to arrange for an MRI of the pituitary gland just to make sure you don't have any tumours. I've just gone through that particular step myself, and everything is A-OK. So it is secondary, I think it's secondary hypogonadism they call it. So my first course of action, the GP didn't prescribe me any testosterone. It was the endo who prescribed the testosterone. The first one that was prescribed was the Testosterone 2% gel, which would sort of be like maybe the British version of Androgel, though I do believe Androgel works a lot better. So 6 pumps a day. Whenever you start on the 6 pumps a day, I believe from the chart here you can see that it administers 60 milligrams of testosterone. How much of that gets absorbed into the body, I have no idea. I didn't find it particularly effective. The injections work a lot better for me. Now, I think after maybe two weeks or so on 6 pumps a day, the brain fog started to lift a bit. I had a lot more concentration. I felt more alert. The anxiety definitely decreased quite a lot. About a month, maybe a month and a half into treatment, my sleep started to get a bit better. Although at the minute it's still not perfect, there's still a lot of improvement to go on that there. Sex drive started to come back. That was actually one of the biggest things I noticed was the sex drive. Now at the moment I'm actually as of today, I've just been prescribed Nebido, which is a 1,000 milligram injection every 12 weeks. Although the endo did say we can do it every 9 or 10 weeks. For what I've seen online, a lot of people don't like to go for 12 weeks between injections. So TRT in the UK hasn't really been too much of a challenge to actually receive it. There's a lot of misinformation out there. It seems to be hit or miss with your GP, whoever that may be. Thankfully, I've been fortunate in that regard, and the treatment so far is going pretty well. I don't know what my testosterone levels are currently sitting at. I just had another whole bunch of blood tests taken this morning, and I will have the results from that there probably next week sometime, and hopefully it's going to be somewhere up into the more probably mid-range, since I'm on 6 pumps a day of testosterone, so it's probably not going to be on the upper optimal range. It's probably going to be mid-level, but the mid-level is far better than where it was before. Previously I was sitting at about 100 nanograms per deciliter. So that was actually lower than a 95-year-old male. So anything above that there is obviously an improvement. Start the injections off Nebido next week. I'm certainly looking forward to getting that there. And then just go from there and see how I feel after 6 months, after a year. And yeah, that's pretty much everything. Progress on my TRT journey. I will make some more in-depth videos to discuss how things are going, maybe what negatives I've experienced from it, maybe treatment, isn't what it's cut out to be. I don't know. We'll find out, and I certainly will update you guys with that there as time goes.